Thank you. Again, good evening. My name is Stacy Judala, and it is my honor and joy to serve as the Director of the Grief Support Services, Clinical Pastoral Education, and Chaplain teams here in the East Market of Essentia. On behalf of our entire department, I welcome you to our 35th anniversary celebration. As much as we would like to gather with all of you in person who have been connected to our programs, we are grateful that the virtual option is allowing us the opportunity to have people from as far away as Arizona, Georgia, and Montana join with us here in Minnesota tonight. As we begin all of our meetings and gatherings at Essentia with a reflection, I would like to offer a brief reflection and blessing for our time together tonight. Listen with the ear of your heart. These are the opening words of the Rule of Saint Benedict, which has and continues to guide our mission and values here at Essentia. Heartfelt listening as we honor and remember and grieve those we love who have died. Heartfelt listening this Christmas and holiday season, the 35th anniversary year for our clinical pastoral education and grief support programs, and heartfelt listening as we live within the COVID-19 pandemic. Heartfelt listening is a practice worthy of our collective attention. We give thanks for the Sisters of St. Scholastica Monastery who were called to provide places for healing, teaching, and connection. The sisters have invited many to join with them over the years in offering deep listening, compassionate care, and hope to navigate any challenge that comes our way. With God's support, with your support, encouragement, and prayers, we hope to continue to live out the value of hospitality, the ability to listen and support people who are in a discernment to a call to serve as a chaplain. And we are called to listen and support those whose hearts carry grief. Together, may we listen with the ears of our hearts to how we are being called to care for our communities and one another in the days to come. Blessings and all love to each and every one of you who have gathered tonight. And I close with these words from an ancient monastic liturgy. Come and visit us in peace, O Lord, and we will rejoice with hearts renewed. Let us rejoice together. Thank you. Next slide, please. During our time together tonight, we would love to hear from all of you who have gathered here tonight. Unfortunately, as we are all adjusting to living in a culture of virtual meetings and gatherings, we know that there comes fatigue with sitting in front of the screen. So we will try to keep to an hour. We may just go over a little bit because there are some wonderful stories of connection and love and hope that we hope to share with you tonight. Please join with me in remembering your own connection to our CPE and grief support programs and how it has made a difference in other people's lives as well. Next slide, please. I sometimes wonder what was happening in 1985 and 1986, that so many thoughtful and caring leaders came together to begin the first hospital-based grief support program in the United States. We give thanks for the thoughtful discernment of Ben Wolf, Kathy Noble, Sister Kathleen Hofer, and Sister Verda Clare. Thank you for setting this path before us that we may care and support one another and our communities. Next slide, please. But the vision and creativity didn't stop with the four of them. The vision for St. Mary's Hospital being a center for vocational discernment and serving and learning was also alive and well, with Sister Rosemary Ferguson, Sister Judith Oland, and Father Eugene McLaughlin. They together in those early years created our clinical pastoral education program to support and train chaplains and faith community leaders. Each of them accomplished much in their lifetimes, and we mourn their deaths, but are grateful for the mission and vision they passed on to us to continue. As I look at the photos of these leaders, I am humbled by their grace, joy, and vision, and continue to be inspired to hear how our forebears in our programs inspired others to join in the programs. Next slide, please. As I shared earlier, we are going to take some time to hear from a number of people. And I think it is only fitting that we begin tonight's conversation with Ben Wolf, our founder of the first grief support program of its kind in the United States, alongside Gina Dixon, our current program manager for grief support services. Gina and Ben, look forward to hearing a little bit about your journey with our programs.
Thank you, Stacy, for your warm welcome, and to everyone who's joining us tonight. And Ben, I want to thank you. I'm so thankful for all the ways that you mentored me and so many others with your infectious approach as the founder of Grief Support Services. Can you just start by sharing what the catalyst was for starting St. Mary's Grief Support Services 35 years ago?
Sure, but first of all, wow, it must be nice to be in Hawaii. I can see that lovely scene behind you. And I'm also glad we've got a couple of hours to have this discussion, so it works out great. As that first slide showed, it was back in 1985. And actually, 2 years prior to that, I was teaching at the University in Duluth, UMD, and Kathy Noble had approached me to see if I would begin a bereavement program for children, which hadn't been done elsewhere. And there was a need at St. Mary's. So I was fortunate in 1983 to develop what's called the Young Persons Grief Support Program. And that was for bereaved youngsters 5 to 8, 9 to 13, and 14 to 17, which of course Gina is still going today. And at that time, it really just took off. And I put together a program at that time about maybe further into a center approach in 1980, the end of 84, approached Kathy Noble, who was the director of social services, and she suggested to maybe even build it a little bit beyond some of my ideas. And so I came back and said, okay, here's what I've got. She said, well, let's try it. So we went up to administration and had a meeting with them, with Sister Verta Claire and Sister Kathleen and Jim Shervney, and presented what I had as some ideas about what we could do at the center. At that time, they thanked me very much, and I then went back to my regular job, and it was Christmas time. I remember holiday time up here in the woods, and I got a call from Kathy Noble, and she said they've approved it, and they're going to give it a try. You're on a contract for 1 year. It either goes, and then we'll figure it out. If not, thank you for trying. And I remember saying to my wife, Barry, I'm going to work hard. They're not going to get rid of me. And we're going to develop a program. So at that point, the program basically got going on January 3rd, 1985. And it was about reaching out to everybody in the community, and also knocking all the doors within the medical center and administration to introduce myself and to talk about what we'd hope to do. At that exact time, we created a continuation of the kids program, but also started the same groups that you are providing now in terms of the miscarriage and stillbirth and parent and suicide. And we also did a homicide group in those days too. And ended up, again, just kept building on things. I was on my own for a few years, and then we hired Kate McTagg as both a therapist 24 hours a week and a volunteer coordinator. And it was just wonderful. It was also during the time of AIDS. You know, today we're talking COVID-19, then it was AIDS. So I was being asked to go up on the floor and meet with people with AIDS. And we ended up, Kathy, myself, and Sister Verta Claire, I'll never forget, the about developing a facility for people with AIDS. And they developed just that for a period of time. So we had a lot of educational programs going on later on. One of those, you had just come on board then, Gina, was the Names Project at the deck, where we had 11,000 people attend. But over those first couple of years, it was really meeting people and introducing myself. And with Kate, and then after the St. Mary's Hospice program started, Kate moved in as the bereavement coordinator for the hospice program. And a little bit later, Gail Held came on as the new therapist and volunteer coordinator, also 24 hours a week. And we had her there for a number of years also. And then the hospital had some challenges, and we just couldn't hang on to her. But Kathy really guided me in a lot of those areas. And she really said, if you think it can go, go for it. We had our challenges, but she also said, go for it. One of those, as an example, was we brought Rabbi Harold Kushner in. We had 2,400 people at the deck to listen to him talk about when bad things happen to good people. We were putting on programs up at Scholastica for the whole community. Terry Tafoya, a Native American, we had him here twice. We had over 500 people one time and 300 another. Every year we would end up in different programs. We also did work with organ and tissue donor families, and we'd put on programs for those families afterwards. Anything at all that we could be involved with in the community, working with school crisis intervention. We had at the deck 2 different training programs for over 600 people throughout the state prior to Columbine and after Columbine. I can't tell you how many times school crisis events took place over those earlier years. And up here in the woods, it could be Sunday night at 3 in the morning or Saturday night at 3 in the morning and get a phone call. I'm working with a school and others. But over the years, we had great facilitators. You came on in 1994. And also we had Mary McGrath, Pat Sigford, and Linda Senta. We had secretaries like Joy Miller and Paula Nash and Jennifer Nelson. And we had interns, and a lot of interns that came in that just literally were part of the program for years. They would come in for 1 year. We would do training programs twice a year, which I know, Gina, you're still doing. And ended up, again, we started the Walk for Remembrance. We started the White Ribbon Campaign. We started the October programs, and also the burials up at the cemetery that are still being conducted today. So obviously it could go on, but those are the kinds of things. Probably the most important thing that I can say about the program is the collaboration. And I mean that, the collaboration between the public relations department, between the chaplaincy department. We were giving talks to the CP students over the years also. We ended up with housekeeping. I remember once, the very first time, Sister Eugene gave us permission to use the chapel. I'll never forget this. It was the very first time we could use the chapel for our very first 1985 memorial service for bereaved parents. And I thought a great idea would be to have a candle that they'd be able to light up at the front of the altar and then walk back. It worked really well until it was all over with, and there was enough wax that we could have skated on it. I'll never forget the housekeeping sister, Sally, I mean, not sister, but Sally, who I swear must have had 15 people in there with irons on the floor getting the wax off. And luckily he continued to let us do it to today. But the interns and the colleagues and the different departments, again, housekeeping department and secretarial folks that were in those departments, every department contributed. The folks at the prosthetics lab, where we were able to do plaster castings of children that had died in late miscarriage or throughout stillbirth that we could do, that I know you're still doing today. Just working with all those departments, and administration was wonderful. Anytime there was a crisis, we would do debriefings or work with the staff to try to help them as best we could, which I know, again, is being continued. I'll sort of stop there because I know we could sort of just, like I said, keep going. But again, I want to thank, and again, in 2007, Kathy Noble was no longer at St. Mary's. At that time, John Gibbs came in terms of our oversight. And John, for those 6 years while I was there, I can't thank him enough for what he did for our program. He was somebody that, again, had always been supportive of the grief support. In fact, in 2000, he and I and Sister Verta Claire worked together to create the program to honor the memory of employees at St. Mary's or the Duluth Clinic within the Essentia system that had died within the past year. So again, John also, I can't thank him enough. So between Kathy Noble, who sort of guided me and trusted some of my instincts along the way, and the same with John later on, I could not have been happier to have leaders in those two, and to have wonderful colleagues and people like yourself, and the community just kept coming forward. We had financial contributions from people because of what they had received from us. We didn't knock on their door and ask for it as much as they just came forward. And this program is one that I hope will continue on for years and years to come.
Ben
Thank you.
and Gina, thank you. And Ben, it now makes sense why I smell that sweet candle wax in the chapel now. It's not just the candles on the altar. I will never forget that story. But I think what I'm hearing from you, you mentored and welcomed Gina in. Kathy and Sister Verta Claire and Sister Kathleen invited you in. And I think that is the beauty of our programs here, is each person invites one more person to join us in being a caring community. And I hope that we will have other opportunities outside of this virtual session to invite you back for conversation. So thank you.
Okay, thank you very much, Stacy. Thanks, Gina.
Thank you both.
We will now turn to our, from now on throughout the evening, instead of saying clinical pastoral education, I will say CPE, which is the acronym for our program of clinical pastoral education. I'd like to now share a recording of a conversation with some of the people connected to our CPE program, and they will introduce themselves in this video.
Well, here I am this afternoon with, up on my left, Christopher Eidson, who is an alumni of our program. He was a student in 2015 and 2016. He took all 4 of his units with us. And I'd like to say he will always be my first student I had for all 4 units of CPE. So it's a very special thing for me. Christopher then worked for a year for us, and then as a casual chaplain, and then moved to Atlanta and got a job at Children's Healthcare, and he has been promoted to the lead chaplain there. And we are so proud of him. And welcome, Christopher.
Thank you so much. It's so good to see you. It's good to be with you.
And then on my bottom left, Sister Sue Fortier has been working as a chaplain at St. Mary's Medical Center for the last 40 years. She has been very deeply involved with our CPE program and our students for the entire 35 years that we've been running the program. So thank you, Sister Sue, for being here.
Oh, it's wonderful to be with all of you.
And Gudrun Wittrak. Gudrun is also an alumni of our program. She started in 1994. She also took all 4 of her units with us. She has worked as a chaplain at St. Mary's, at Miller Dwan, from 99 until retiring in 2010 from the pain management clinic at Miller Dwan. She is also a member of our professional advisory committee for our CPE program, and she's been incredibly important and faithful since 1998. So welcome to you.
It's a year.
Yeah. So if we don't have a lot of time, so we're just going to jump right in. Christopher, would you start by just telling us a little bit about what CPE has meant to you?
Absolutely. I would say that my time, the 2 years I spent at St. Mary's in the CPE program was definitely a transformational time for me. When I started the program, I had been a pastor in the past, and I was used to talking a lot. I had something to say when I got there. And then what I realized in the program is that chaplaincy is all about listening, and it's empathy, and it's not advice giving, and it's not fixing. And to that point, that's what I was used to. So what I had to learn how to do was to be quiet and to sit with myself. And that was really uncomfortable for me. It was a huge challenge for me. I was one of those people that would watch TV with my laptop in my lap and headphones. I always had a lot of things going on. And what CPE taught me was it was because I didn't know how to connect with myself. And without knowing how to connect with myself, I could never efficiently connect with anyone else. So my biggest takeaway from that time was just learning how to be still and to be quiet and connect and get to know who I am. I think that's one of the things I still, to this day, I still value. Had I never became a chaplain, that is something that I would have taken away, and it would have been for life.
I have to add, when I got the chance to meet your now wife, she thanked us for
I bet she did. I bet.
right? The man that you have become.
Yes. Well, connecting, I can now connect with her through being a little more quiet and calm these days.
Oh, thank you.
Thank you.
Well, Gudrun, what has it meant to you, your experience with CPE?
Well, it's meant so much to me in terms of transformation, as Christopher talked about, that movement and feeling called. I met Sister Rosemary at a supper at another chaplain's home, and immediately there was a spark in me that said, I need to follow this woman wherever she goes. I need this. And then I started CPE and did my 4 units with her and Judith, and under the tutelage of Sister Sue, so happily, colleague and friend. My first call night was with Sister Sue, but it was, I was called to the ER, and there was Sister Rosemary having an asthma attack. And it was my first call, and I was a deer in the headlights. I didn't know what to do. And of course, then Sister Sue and Sister Judith were called, and another chaplain. And Sister Rosemary is lying there with intubation, and I'm the deer in the headlights, and she does this. And I said, sing? Do you want me to sing to you? She nodded. So I started singing, and then the other chaplains came, and we stood around her singing. And Christopher at one point talked about falling on your face during your calls. That's when you learn so much about yourself. And I learned so much about myself, about presence, about being present with people. And it isn't what I say or do, but being present to them and their lives. And it's been such a rich part of my life and carried on post-retirement into what I do with people at our church and beyond. So it was transformational as well.
Mm-hmm. Thank you, Gudrun.
I remember the night well. I was holding her head, and I said to the doctor, you've got to save her brain. She's got the best brain in Duluth. And we were also present to one another, so lovingly present to one another, and to Rosemary and to the medical staff that night.
Mm-hmm.
It was terrifying for them, as I remember.
Yeah. Wow. Well, Sister Sue, can you tell us a little bit about the beginning, how this whole thing started? You were there.
I was there. First of all, I want to thank and acknowledge the Adrian Dominicans and the Benedictine community at St. John's and our own Benedictine community here at Scholastica for allowing us and giving us the opportunity to create this chaplaincy department and the CPE center. And when you talk about transformational, it's been the most transformational part of my whole life, working with these creative, visionary, passionate co-workers who became lifelong friends. Well, the beginning of CPE, the seed of CPE, started at a liquor store of all places. It started at the liquor store on London Road. St. Luke's had just closed their CPE center, and we had heard about it. And somehow Rosemary and Eugene found themselves at this liquor store, and they ran into each other. And the manager came down, they saw them talking, and he came down and he said, "Can I help you?" And Rosemary said, "Yes, bring up 2 chairs because we're going to be here for a while." So they did, and they talked about the closing of St. Luke's, how surprised they were and how they felt that they needed to have a CPE center here in Duluth. And so Rosemary, with the closing of St. Luke's, knew that she would be the only chaplain there, and she didn't want to work alone. And so she went and searched for a job. She went to Minneapolis. She went to Little Falls, Minnesota, to a small hospital, had an interview there. And she came back and she said the most serious surgeries they had there were fixing broken ankles, and she thought she needed more of a challenge. So during this time, she came back and she applied here at St. Mary's and was hired as an oncology chaplain. And it was shortly after that that Eugene made it known that he wanted to have a CPE center, and he was encouraging Rosemary to become a supervisor. And so we drove to Wilmer, Minnesota. I became certified there, and Rosemary met with a team, 2 priests and Sister Judith, to become a supervisor. And the priest thought she needed to go through more hoops to be a supervisor. And so they said she could start the program, but she had to be under the supervision of Sister Judith. So she always said Judith saved the day for her, and she came back and started this program that continued to flourish for 35 years. And I need to say, before I came up here, before I went to lunch today, I turned on my phone, and out of nowhere flashed up an email from Rosemary. I mean, Rosemary, Judith, and Eugene are with us at this celebration. And when I look back upon these years, I think of them as the Camelot years. And when I called Eugene 2 days before he died, he said, "Susie, we were in Camelot together." He thought of these years as the Camelot years of his life. And I know Rosemary did too. So it's been very transformational to see this baby grow up and to be a part of it all these years. Gratitude.
Yes.
Deep gratitude.
Thank you. Thank you.
I think Eugene would be delighted to know that the seed in the liquor store grew up to be what it is today. He would love it.
And I think Eugene would be just thrilled that Sonia is now the supervisor at St.
Absolutely.
Oh my, wouldn't he love it? And Rosemary too. And of course, Judith gave her blessing endlessly to you.
Thank you. Yeah.
And that's what Rosemary and Judith both said when Sonia and I drove down for Judy to say her goodbyes to Rosemary. They were so thrilled that Sonia would be the director of our program.
Yeah, that was very special. Judith had just a couple of months to live, and I had never met Rosemary
Mhm.
and had always wanted to. So Sister Sue and Sister Judith and I got in the car and drove all the way to Adrian, Michigan. We didn't know if Sister Judith was going to survive the trip, and I got to meet Sister Rosemary, and what a she just sparkles, even in her 90s, just so much passion and love and joy. Yeah, just amazing to be and like we all still really feel that support from the founders. It's amazing. And Christopher might even pursue this path someday.
Absolutely. Yeah, the time in my life, CPE, that, like we said, a word that we keep going back to is transformational, and it just meant so much to me. And as we speak about all these people that kind of went before us, and like Sister Sue and Sonia are still there and doing the hard work. I mentioned before the call that I hear those voices in my mind, in my spirit, in my heart, as I continue to work with students in Atlanta on the other side of the country. I get to impart what was so freely given to me there at St. Mary's. I get to share that with students hundreds of miles away, and it's just so meaningful. And I love hearing those voices. I love hearing Sister Judith, and I love hearing Sonia and Sue, all my mentors there. It was an amazing time that has really stayed with me, and is now who I am. It's a part of who I am.
Well, on that note, that's our time. We could go on, but thank you all so much for being here this afternoon and sharing.
It's wonderful.
Thank you.
Thank you, Sonia.
So good to see you all.
You too,
Good to see you.
Christopher. And Gudrun down the block.
Down the block.
Okay, I'm ending.
What a gift to hear some of our.
Here I am.
Oh, sorry. Oh, there we go. Sorry about that. Before we hear our next video, I need to share that I give thanks for those stories. I also was someone like Christopher and Gudrun who trained as a chaplain here in 2002. And Sister Sue was my mentor at that point, and it was at that moment that I heard the call to become a chaplain. And Sister Judith was my supervisor. Little did I know that in 2017, I would receive an invitation to come back here and serve as the leader of the department as John Gibbs retired. And I still remember Sister Judith's final words to me. I went and met with her at the monastery the week before she died. And she shared with me her hopes for a long future for CPE, to continue to be a place for people to learn and grow. And I'm seeing that that is happening. And I know from on far, from the heavens, Sister Judith, Sister Eugene, and Sister Rosemary are continuing to guide and inspire us in this work. As you heard from Ben earlier this evening about the power of community members coming together and responding to crises when they occur in our communities, we would like to now hear from a grateful community member, Colin Shady from Husky Refinery.
Greetings from the Superior Refinery. A little over 2.5 years ago, we experienced a catastrophic explosion and a fire. That day, and the days and the weeks following the event, our friends and neighbors in the community opened up their hearts and showed their support for our family. Essentia counselors spent many hours on site talking to our employees and giving them the comfort they needed to begin their personal recovery from this experience. The program's outreach and support was instrumental in helping our team move forward from that day and embark on an ambitious journey to rebuild their home away from home. We've made great progress on rebuilding and restarting the refinery, and we honestly could not have made it this far without the support of Essentia's grief services. On behalf of the Superior Refinery, we thank you, and we are pleased to help support you on this journey.
Thank you, Colin, and thank you for the resilience of your team who continues to work to serve our communities. We would now like to hear
Greetings from the Superior Refinery.
from a grateful patient who then became a grateful caregiver to others, Sue Genta.
Sue, thank you so much for joining me today. And I'd like to start by just asking you to share a little bit about, the support that you received early in your grief from Grief Support Services.
8 years ago, when my son Jim died, I really didn't know how I was going to survive. And grief support made it possible for me to go on with my life. There's such pain when you lose someone you love so dearly, and nothing can prepare you for that pain. I was fortunate that I had the opportunity to become part of the grief support group for parents who had lost older children. And from the very beginning, I knew that was where I belonged. I needed to be there. And month after month, I went to those meetings and I talked about my son. I talked about his death. I talked about his life. And it was a safe place where I could say his name and where I could cry. Every time we were in that room, our children were there with us, and we were there to support each other. We talked about things like how hard it was to go out into the public and how hard it was to talk to people, because people were afraid to mention our children's names and they didn't want us to be upset and they didn't want us to cry. We shared our pain and our hope and ideas for things we could do during the difficult times. We understood each other. Everyone talked about ways they were honoring their children's memories and things they were doing, and that was so helpful to me. Grief is something that we always carry with us. It's never going to disappear. But we also knew that the love we had for our children was always going to be a part of us. And our children were always going to be with us in our hearts and in our memories. During those same 2 years, I was also able to meet with Gina, one-to-one counseling, and that helped me so much. She listened to all of my complaints about how I was feeling, and she understood. I could be totally honest with her. I could tell her anything. And Gina, you kept reminding me that grief is normal and that I would be able to go on. You gave me coping strategies that I could use when the grief seemed to be just overwhelming. And also, you taught me the importance of rituals of connection. And I went away from there using those rituals of connection. And every year, on the special days, on the holidays and birthdays and anniversaries, I make sure I do something meaningful in my son's memory. And I really appreciate everything you did for me to help me go on with my life. I was also matched up with a volunteer from the Person to Person support program during that time. And this was a woman who had lost a son close to my son's age under similar circumstances. And it gave me another opportunity to talk to somebody who I knew really would understand what I was saying. And we shared stories. We talked about things our boys had said and things they had done. And some of those stories made us laugh and some of them made us cry. And it was comforting to hear about things that had helped her navigate her grief journey. I knew that missing my son, thinking about him every day, was okay. It was normal. I actually realized that I was going on with my life about 2 years after Jim died at a grief support meeting. when one of the dads there said to me, "You've really changed." I thought about that, and I thought, you know, I'm no longer just talking about my loss, but I was talking about things I was doing to honor Jim's life as I was going on with my own life. And I knew then that I was a survivor.
Thank you so much for sharing your love for Jim and what it's taken to get to where you are today. And I'm wondering if you could just say a few words about, what inspired you to give back to grief support services and become the facilitator that you are today.
You know, grief support had given me so much. It had really given me my life back. And everyone I'd met at grief support was really a blessing to me. And I wanted to keep that connection. And I felt that it was time for me to give back. And I was very fortunate 2 years ago to have the opportunity to become a co-facilitator for the grief group for parents who had lost older children. That group had been so important to me. And I knew that I would try my hardest to be there for each and every person who came to that group. And they would be able to see that I was a survivor. I had survived. And even though I was still grieving, and I hope that helped them believe that they would be able to survive too. Grief support is just such a very, very special place. It's given me a sense of belonging to a group of people who really care about others. It's a community of people who are there to help. And I am so honored to still be a part of that community.
Thank you, Sue. I couldn't say it any better. We're honored to have you as part of our grief support family. Thank you, and take care.
Thank you.
I echo Gina's gratitude. We continue to be thankful that Sue comes alongside other families in their times of grief and walks towards a journey of hope, honoring and loving their loved ones. Let's now turn towards Julie Ekman, another grateful community member and member of the Essentia family, who has also received care from us and provided care to others. Well, good evening, Julie, and welcome to our 35th anniversary celebration for both grief support and chaplaincy. It is so good to have you here with us tonight. I wish we were in the same room, but for now we will celebrate that we can be together virtually. And I'm wondering, for all who are gathering with us tonight, if you would be willing to share a little bit of your connection with our grief support and CPE programs.
Oh, Stacy, I would love to. The Grief Support Center has meant so much to me through the years, and I've been a part of it for a long time. You know, when you think back over all the years that Ben Wolf was guiding it, creating it, and then guiding it, and then passing it off, thousands of people have been impacted by what has happened there in the Grief Support Center. And it's been a model through the years nationally. So we are very fortunate to have it here in Duluth and have it ongoing. It's very, very important.
Wow. And you've been connected with the grief support program since the earliest days of the program, is that correct?
Yes. I had a daughter who died 34 years ago, and I did see Ben then, and the program had been in existence for a year. My journey through trying to find some reason to go on was through many different directions. One being St. Scholastica and doing a degree in religious studies with the guidance of Bob Renning, who was also a friend of Ben Wolf's. And Ben called me a couple of years after Inger had died and asked if I would co-facilitate the group for parents who have had children who've died. Mm-hmm. And I knew that that was a tap on my shoulder to pay attention and to do this. Do this for myself now, and also to go on the journey with other people and be a part of it. I love being with people. I'm an old nurse. I'm an old caretaker. I knew that this is where I needed to be. And so because of that, I stuck around for 20 some years and did this once a month for the people who were participating in the grief support for children who have died. The beauty of I think our program is that it's specific in the kind of grief, the kind of death that has happened. And so they're not mixed up, which I think is really important because each kind of death is so unique. So the parents who came were safe. I really feel that, and they talked about that the hour and a half that they spent sharing their stories of their child was sacred time, truly sacred time. And they were able to really express themselves in all the emotions that we have in our grieving process. It was just such an honor for me to continue that work, and it certainly helped me in my grief. And I have this funny little thought that Inger was kind of hanging on my shoulder once in a while, and I would share that with them. And then we would all talk about how we can or have integrated our child in our life now in new ways. So yeah, I love to think back at all the wonderful people who came through, and interesting enough, at the beginning, of course, it was just mothers, and as years went by, more and more fathers dared to come and put their toe in the door, and by the time I retired, there were fathers coming without mothers. So, I really saw a lot of lovely opening up of people through the years and understanding of the grieving process. Because it's ongoing for the rest of your life.
Yes. Well, Julie, as I hear of your deep and ongoing love for Inger, I also hear of your deep and ongoing love of our community and supporting other parents. As you think about our grief support program in the future, what would be some hopes that you would have for us as we continue this work of supporting and loving our communities and honoring those who have died?
Well, I certainly hope it continues. I know that, it financially it is how can I say this nicely? Anyway, people don't have to pay to be there, and it's open to all people. And so it is a free offering that St. Mary's Essentia Health now, I need to say, offers to the community. And it is, it's just hard to imagine how worthwhile it is, because you can't put a price on what the healing process has done for people. It filters out in the community. People who have been in a grief support program at Essentia tell their neighbors and friends and family and children, and people become more and more educated and understanding how to help one another. so I think it's so important that it continues, and I certainly hope it does.
Well, Julie, thank you for joining with us. And as this evening unfolds tonight, we hear again and again that it is the connections to other people who open their hearts to care and listen. And we are so grateful for the ways that you have listened to others, and that in your love for Inger and your family, that you help others navigate how to keep on living and keep on loving their loved ones. So thank you for your time with us tonight.
Oh, thank you, Stacy, for doing this. Thank you very much.
We will now go to the next slide. What an honor and joy it was to hear from so many people who are so deeply connected to CPE and grief support services. As we have heard what a difference our programs have made for people over the years, it is my joy now to share with you some of our plans for the future. As many of you know, we are underway with a construction project of building a new hospital, and it is being referred to as Vision Northland as we prepare for the future of healthcare in our communities in the Northland. And with that, and our 35th anniversary, it is time for us to look at a new place within the Central Hillside that we can provide care to our grief support services families, and also to our CPE program. Our new grief support and CPE center will be located on the corner of the 5th Avenue and 3rd Street in Duluth. I'm going to show you a few brief renderings from our architectural team of what we are envisioning this new space to look like. Next slide, please. Within the 2nd floor of this building, we are creating a quiet and welcoming space for people to receive care and to learn and reflect on their call to support others. Next slide, please. We are grateful for natural light and views of the lake and a calming atmosphere for individual therapy and our classroom time for our CPE interns. Next slide, please. We will also have space for children and adults to meet for support groups and therapy. And now, without further ado, I'd like to turn back to Gina Dixon and Sonia Anderson, our program managers for grief support and CPE, to hear a little bit from them about what these spaces will mean for them and the programs and the future of those who we are honored to serve. Sonia and Gina, thank you for taking a few moments to share a little bit about your hopes for the future, both with our CPE program and our grief support program. Before we go any further, I just want to take a pause and say thank you to both of you. In the midst of this pandemic and the complexities of this time, I've been inspired by both of your passions and commitment to supporting patients, families, and our teams, and our student interns, and our communities. And both of you have been creative and innovative. And I just hope that as we leave this pandemic time and look towards a brighter future, that your creativity and passion for this work will continue. But it is a joy and inspiration to work alongside both of you. Sonia, I'm thinking about it as we've heard from so many people who are connected to our CPE program. I'm wondering if you could share a little bit about your hopes and vision for the future of CPE here at Essentia.
Yeah, absolutely. I'm so happy to be here, that it's this incredible privilege that we're in this time of the 35th. And Stacy, you're bringing in this reality of the pandemic. And I think, gosh, this experience of the pandemic has really brought into such clear focus how important the work is of our department and all, chaplaincy, CPE, and grief. And I'm looking back before I look forward. I'm just, as we prepared for this, I'm so aware of what has been possible because of the many people who have supported our CPE program. And in particular, it's important for me to say Marianne Manji brought such heart and passion to this program 35 years ago. And as I've looked back at all the pictures of all the CPE students in the 35 years, how that generous support has made so much possible for so many people. And as we look to the future, we're in a brand new day of providing, it's kind of like going back to our roots where we had such a dynamic, vital program with 2 supervisors. And then in the middle years, it was kind of hard to find a second supervisor. And now we're moving in that direction again. And we're able to offer so much to the community, and not just our Duluth community, but now with technology, we're able to reach people in Iowa and North Dakota and Upper Michigan even. And we'll just be able to continue to offer more and more types of CPE and reach more students. So, and I'm really excited about partnering with grief support in the new space, but maybe I'll leave that to a little further in the time.
Okay. Thanks, Sonia. And it has been a silver lining in this time that our use of virtual meetings and gatherings has allowed us to expand the geography of our program. And one thing that has been exciting for me in this last year is Sonia has made it possible for students from across Essentia in Brainerd and Detroit Lakes and Fargo to participate in our CPE program. So what started at St. Mary's in Duluth has now expanded in some remarkable ways. So thank you. Gina, I'm wondering if you would be willing to share a little bit as well about your hopes for the future of grief support services at Essentia.
Thank you, Stacy, and Sonia as well. And I echo what has been said, the gratitude for all those who have gotten us to where we are today. And as we build on those hopes for the future, certainly in the midst of COVID, we have rapidly worked to expand our virtual grief therapy. And as we look to the future, looking at how we can continue to provide that support through virtual support groups, particularly to underserved communities and populations, and in physical spaces as we're able to return to expand services at the YMCA and the Hermantown Wellness Center, and looking at expanding support to our healthcare employees who have been so critically impacted by this COVID stressors. The collaboration that we've seen and hope to continue as we share our grief and trauma resources throughout, as you named, North Dakota and those other areas that are served by Essentia. That's an exciting time to use this technology to help others who have been under-resourced historically in rural clinics and hospitals, and expanding our school-based resources as well, and providing with the new space, and we're going to talk about this more in a minute, but the opportunity for youth to meet at the same time as adults is a very exciting proposition that we've been having our hearts set on for quite some time, and I look forward to talking about that more.
Thanks, Gina, and thanks for your willingness to both grow a main center for grief support services, but to expand outward And this new connection with the Hermantown Wellness Center and the YMCA is really exciting to see, where some people living beyond the center of Duluth might be more inclined to receive care in Hermantown. And so that we can provide both of those options together is just really exciting for me as I look at the future of our grief support programs. All three of us have mentioned the importance of a new space, and we've shared images here tonight of the renderings from our architectural team and facilities team of this new space. And Sonia, when you look at this potential of having a new space, both for CPE and grief support right next to each other, anything you'd like to share with those who are gathered tonight about why this space matters to our CPE program?
Oh, yes, I'm excited about so much. I think I'm most excited about being together in this space. And at our work, we've been together in the department, but we haven't had the space to come together physically. And now we will. And I think that's going to make both of our departments or our areas just so much stronger. So I'm really excited about that and really grateful for that opportunity.
Great.
And then, just the care that's going into the design of those spaces with the people who are being served in mind, and the type of trauma and issues that they'll be coming in with. There's a sense, and I hope you all could get this from the pictures, that there's such care for the folks who are coming in to have that sense that we were thinking of you before you even got here. And I think they're really going to feel that. And I think that is really, really important in their care. And I feel really excited about that and proud that we can offer that to people. Yeah.
Thanks, Sonia.
Yeah.
And Gina, I'm thinking about a year ago at this time, you and I were invited into some conversation with people who've received care in our grief support program. And we heard some consistent themes of what is helpful for people who are in need of care and counseling in the midst of a tragic loss or death within their family. I'm wondering if you can speak a little bit about what you see as being helpful in this new space to those that we will serve in the years to come.
Absolutely. As Sonia mentioned, so much of our planning efforts were really driven with those we are serving in mind and the feedback that we received. So, for example, I'm so excited that our therapy spaces will have natural light and serene environments and spaces that are really welcoming and healing spaces. Having a dedicated waiting area that is private and calm and has resources available as people wait for their therapy appointments. As I mentioned before, the opportunity to have groups simultaneously. So being able to serve bereaved adults, bereaved parents, and their surviving siblings, their children, is really a best practice and an exciting possibility. And as we're looking to the future, the idea of having a dedicated pediatric area. So as we have either groups for young children or having space for play therapy where there can be movement and activity, which really meets children where they're at, and helping them to thrive in the midst of the darkest times. And I can't express my gratitude enough for all those who are supporting these new beginnings. It's an exciting time to be a part of this program, and I'm so thankful for all of those who are supporting these new beginnings. Thank you.
Thanks, Gina and Sonia. And as I've listen to both of you, I hear a common theme of welcome and a healing, calming environment. And I think about our Essentia values and hospitality being one of our values. And when I look at the renderings of our new space, I see it as a welcoming space. And I know as we look at the future, the three of us have talked about the desire to have hospitality be a core part of our CPE and Grief Support Center. And so beyond our individual therapy or working with chaplain interns, we hope that our space can be a space that we might provide some staff support sessions or education for the community. And we will look forward to being host and welcoming to people when they need a quiet, calm space to gather at Essentia. Well, thank you for sharing a little bit of your hopes and for the future. And I look forward to living into this future with the two of you and our whole community. Thank you for all that both of you do.
Thank you, Stacy.
Thank you.
Thank you, everyone who have stayed a few extra minutes with us. It was hard to know where to stop the stories and the memories. We just felt that it was too valuable, all the things that people shared. So thank you for staying for a few extra minutes. We are at the final minutes of our time together. And as we close, I just invite each of you to take a pause and remember what brought you here today. Perhaps you were remembering a loved one who died. Perhaps you are an alumni of our program. Whatever brought you here tonight, we are glad that you joined us. And as we gather this evening, our hearts are with the patients and families who've benefited from our grief support services and chaplain training programs. With patients and families in mind, we are inviting you to join us as we kick off fundraising for the future of these programs. Donations can be made to the Essentia Health Foundation in honor of our 35th anniversary celebration. You can also give online by following the link in the chat on this Zoom or in the email that you received for the invitation tonight. You'll also receive a follow-up email with a recording of this event that you can share with someone who may not have been able to attend tonight. And we will offer an opportunity to give at that time as well. To date, I am overjoyed to share that we have raised nearly $30,000 in the last month towards the new space for patients and families to heal with our grief support team and our CPE program. Can you or your family consider a gift and join us this evening as we prepare for the future? So far, we've received gifts ranging from more than $10,000 gifts with multi-year pledges or a $25 gift. Any amount makes an incredible difference. The future of these programs in their new space allows us to better serve patients and families, and it will become a reality with philanthropic support from all of you and from other people in the community. Thank you for giving, and thank you for being a part of these meaningful programs. We appreciate you, and we look forward to a healthy future together. And just like a good movie where you don't want to say that it's over, we also have a few final credits. We understand if you need to leave right now, but we would like to send you off with some memories from days gone by. We have a slideshow of some photos of the last 35 years and a few brief videos of people who want to add their gratitude. This should last less than 5 minutes, so if you're able to stay with us, we welcome you to stay through the credits. And if you need to leave, we look forward to connecting with you in another way sometime soon. Thank you to everyone who joined together tonight.
Hi, I'm Rebecca Cochran, and I'm grateful for St. Mary's CPE program because it has given me a space that can hold new insights about myself, those that are challenging and those that are joyous. Having this learning experience at St. Mary's has also meant that I've become more confident as a pastoral care provider and has inspired me to be curious about the experiences and stories that shape the beliefs and behaviors of myself and of others.
My name is Katie Kruger, and I am a casual chaplain and CPE student at St. Mary's Medical Center. The experience I've had with CPE at St. Mary's has been extraordinary. Sonia's flexibility at the beginning of this pandemic was really remarkable and such a gift to us as we tried to adapt to the challenging circumstances of not being able to be present with patients who had COVID and finding other ways of showing up for them. Today, I am benefiting tremendously in my second unit from the mentorship of Sister Sue and learning what it means to be there for the medical staff in the hospital as well as patients. And finally, I can't say enough about how this experience of CPE is without a doubt the best preparation for ministry that I could imagine. So thank you for your support of St. Mary's CPE program.
Hi, I'm Coral, and I think what I'm most grateful for about grief support services is the people. So first, initially meeting Ben and being able to just sort of train under his legacy, meet people, not just locally, but nationally that I could connect with that were doing the same types of work. And then of course, following his legacy was Gina, and being able to work with her still professionally has been the best part of my work with grief support services.
Hi, I'm Tim Birdall, and I'm so thankful I got a chance to intern with the Grief Support Services. The staff there are so knowledgeable in how to walk with people who are grieving, how to help them get into their next day and into their next day. The staff carries such connecting compassion, and they combine it with this expertise on how to be there for people in the ways that are helpful to them as they move forward, honoring their loved one at the same time. I also am so thankful for the Grief Support Services for the ongoing continuing education events that they offer, the annual conferences, the ways that I'm able to attend and learn better and better how to be with people in my own experiences with grief counseling. So I appreciate so much what the Grief Support Services has been doing throughout the years.
Hi, I'm Rebecca Cochran.
And we now send you off with the credits. You are welcome to join or remain for these last walks down memory lane, but know that we will send it to you as an email recording if you'd like to view it at a future date. Thanks again, and have a good evening. Be safe and be well. God bless. Good night, everyone. Be well.